Good evening, friends. Welcome back to the channel. Today is June 24th, 2026, and we are diving into a massive day for medical news. We have answers to how the bird flu is hiding, a major update for anyone taking popular joint supplements, a massive global cancer report, and a new government crackdown on everyday over-the-counter medications. Let's get straight into it. Segment 1, the H5N1 bird flu enigma solved. For months, scientists have been scratching their heads trying to figure out why the highly pathogenic H5N1 bird flu has been silently hiding and spreading inside dairy cows. Well, a groundbreaking study published just hours ago has finally solved the mystery. Researchers discovered that the virus isn't behaving like a typical respiratory illness in these animals. Instead of targeting the lungs, H5N1 is directly attacking the cow's udders. The study reveals that the specific receptors the virus prefers are heavily concentrated in mammary tissue rather than respiratory systems. Why does this matter to you? This breakthrough completely changes how global health agencies like the World Health Organization track the virus. It allows scientists to better predict future cross-species mood graphics showing a bottle of glucosamine transition to an animation of a human brain with mild cognitive impairment. If you or a loved one take supplements for joint pain, you need to hear this. A major clinical study trending across medical platforms like Medscape has linked glucosamine, one of the world's most popular joint supplements, to a faster progression of Alzheimer's disease. The data indicates that patients already experiencing mild cognitive impairment who regularly took glucosamine showed a 25% faster progression toward full-blown Alzheimer's compared to those who didn't. Scientists are urging patients with memory concerns or early-stage cognitive decline to consult their doctors immediately regarding their joint care routines. Segment 3, the AACR Cancer Disparities Report and New Revolutions. Next up, the American Association for Cancer Research just released its highly anticipated Cancer Disparities Progress Report 2026. The findings highlight sharp public health challenges. Black and American Indian or Alaska Native populations continue to experience the highest overall cancer death rates in the U.S., while individuals living in rural counties are 17% more likely to be diagnosed with colorectal cancer. But alongside these systemic challenges, we are seeing massive wins in cancer biology. Scientists have successfully exposed a major genetic vulnerability by turning a good guy DNA-protecting gene called EXO1 against cancer cells. When overproduced, this gene acts like rogue molecular scissors, cutting up cancer DNA from the inside out. Furthermore, the real-world impact of GLP-1 weight loss drugs like Ozempic is expanding. New clinical data shows a stunning 30% lower risk of breast cancer in women utilizing these therapies. Additionally, a new study in the European Journal of Preventive Cardiology confirms that patients on GLP-1s undergoing intensive cardiac rehab manage to shed body fat while completely preserving their vital skeletal muscle mass. Segment 4, Global Health Crises and Policy Crackdowns. Shifting focus to international health news, a massive public health emergency is unfolding in Sri Lanka. The country is battling a severe dengue outbreak, with over 47,500 cases in hospitals operating far beyond maximum capacity. The crisis has escalated to the point where a military-led monitoring unit has been deployed to handle the logistics. Meanwhile, a massive legal shift is taking place across South Asia. Under the newly implemented Drugs Fifth Amendment rules, the government has completely banned the over-the-counter sale of all syrup-based medicines, including standard cough syrups. Moving forward, a strict doctor's prescription is legally required to purchase them, aiming to curb widespread medication abuse and safety incidents. Segment 5, Clinical Tech, RADI and the Dark Matter of Food. Finally, let's talk tech. Radiology is entering its second wave of artificial intelligence. Leading experts from Deep Look Medical have unveiled advanced visual intelligence systems. Instead of working in isolated data silos, these new AI tools combine patient history, imaging data, and genetic markers simultaneously, allowing radiologists to make faster, flawless treatment decisions for complex conditions. And in a fascinating dietary discovery, researchers have announced that most of what we consume is still a scientific mystery. Dubbed nutritional dark matter, scientists are now mapping thousands of hidden food chemicals that go completely unlisted on standard nutritional labels. Early data suggests unlocking this hidden world will completely rewrite how we understand disease risk and healthy aging. Does a high-protein diet help with weight loss? Yes, a high-protein diet can help with weight loss by making you feel fuller. But stay on it only for a short time to avoid possible health problems. Remember, your weight loss probably won't last if you go back to unhealthy eating habits. Talk to your doctor about healthy diet changes that are easy to maintain and can boost your health and help with weight loss. The best and most effective healthy eating plan is one you can follow for a long time. WebMD. Subjective age, how old a person feels rather than how old they are, may offer clues to sleep health and daytime functioning. In a cross-sectional survey, adults who reported feeling older than their chronological age consistently reported more insomnia symptoms, less regular sleep, and greater daytime impairment, even after accounting for chronological age, sex, race, depression, and anxiety. Medscape. Outro/call to action. That wraps up your essential medical briefing for June 24th, 2026. Which of these breakthroughs surprised you the most? Drop your thoughts in the comments below. Don't forget to hit that like button, subscribe for daily cutting-edge health updates, and share this video with someone who needs to see it. Stay healthy, stay informed, and I'll see you in the next one. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.